Welcome to my video on overview of assessment procedures for child language disorders using concept maps. Overview of assessment procedures for child language disorders includes three factors: the assessment of early language development, informal assessment, formal assessment test to assess language. So, 4 points are under assessment of early language development: the general procedures, procedures in direct assessment, assessing minimal verbal children, assessing multi-word combination and skills. General procedures consist four different types of procedures: the case history, parent interviews, direct observations, direct testing. Case history is gathering information about prenatal, perinatal, and postnatal, past, current medical status, situation of family, the condition of family. Parent interviews are the questionnaires to obtain information about child's communicative abilities, vocabulary of parents, expectations about communication. Direct observations are here the clinicians will observe the child's communicative model with parent and other primary caregivers directly. Direct testing involves informal assessment techniques which are used to elicit the desired responses and stimulability. Second point is procedures in direct assessment. It consists the play behaviors using gestures, signs, symbols like pointing and directing, using non-verbal responses to verbal stimuli, possible spontaneous word productions and word imitations, communicative intent, use of appropriate objects. Third point is assessing minimal verbal children. It uses grammatical morphemes. Morphemes are a morphological unit of a morphological structure used in a language. So assessing minimal verbal children uses grammatical morphemes, pre-syntactic devices, simple phrases, and mean length of utterance. MLU, the mean length of utterance, is the length of a pronunciation word made by the child or client. Simple pragmatics: naming familiar objects, comprehension of phrases, simple phrases. Comprehension is understanding. Phrases are combination of 2 to 3 words. Whether the child is able to understand the simple phrases. Fourth point is assessing multi-word combination skills assessed by using more advanced grammatical morphemes, pragmatics using syntactic structures and semantic relations. As we know, syntax is the grammatical structure of a grammatical order of a language, and semantics is the meaning of a word. Second point is comprehension of conversational speech and response to simple commands. Comprehension is understanding the conversational speech and whether the child is able to respond to simple commands. So these 4 points will come under assessment of early language development. Second factor is informal assessment. Informal assessment is an important component to complete language evaluation. Informal tasks can be based on receptive, expressive ways and clinicians' creativity to assess child's targeted behaviors, to know child's linguistic abilities, etc. So, it depends on the clinician's creativity to know about the child's behavior and linguistic abilities. Clinicians can ask the child to follow oral commands, to count, to recite the alphabets, and to perform serial tasks, to name objects, pictures to point objects. So, third factor is formal tests to assess language, that is tabulated by test, causes, disorders, age, and assessment areas. First test name is Comprehensive Assessment for Cleft Lip and Palate. Its causes can be hereditary and congenital. Hereditary is through genes, directly through genes from person to person. Congenital is due to prescribed drugs during the gestation period. What are the means the effect of drugs during gestation can cause congenital disorders. This disorder is cleft lip and palate. Ages affected may be up to 0 to 3 years. Assessment areas are expressive and receptive vocabulary, verbal ability. Second test is language processing test. Causes can be endocrinal and surrounding factors. Endocrinal is hormonal, surrounding is surrounding environmental factors. Habitat. Disorder is called psychomotor disorder. Psycho is mental, so mentally the speech disorder is called psychomotor disorder. Age 0 to 3 years. Assessment areas are child's language abilities, child's linguistic abilities, semantics, pragmatics. Next test is psychological language assessment. Causes can be psychomatic and psychological factors, so wholly dependent on mental health of a child and mental performance. Disorder is called psychomatic disorder. This is the psychomotor disorder, and psychomotor disorder will be due to endocrinal and surrounding factors. Psychomatic disorder is wholly on psychological factors. Ages affected can be up to 3 to 8 years. Semantics assessment areas are semantics, verbal ability, syntactics, and grammar. Another test is Cognifit's cognitive assessment test. Causes are unknown till now. It is inability to learn. Dyslexia. Disorder name is the dyslexia, the language learning disorder. Ages affected are 2 to 7 years. Assessment areas are comprehension, reading, writing, learning, expression. Another test is test for auditory comprehension of language. Causes are improper auditory functions. Disorder is named as hearing impaired. Ages affected are 2 to 3 years. Means within these ages, all these disordered or problems can be identified. Assessment areas are expressive and receptive vocabulary and verbal ability. Next test is the apraxia profile, quick assessment and quick assessment for apraxia. Causes are due to neurological damage and motor disorders like verbal and oral. Motor is nothing but movement, so there is a disorder in movement of organs. So during speech, all the oral and motor organs should move to make their speech properly. So these are the causes here. Its disorder is known as childhood apraxia. Ages affected may be 3 to 6 years. Assessment areas are to assess language disorder, to define aspects, domains affected. So this test will help to assess the language disorder and to define the aspects and domains affected as well. Semantic, syntactic, phonologic memory will be assessed by this apraxia profile test. Another one is aphasia diagnostic profiles, assessment of language related functional activities, quick assessment for aphasia, Boston assessment for severe aphasia. So this totally comes under aphasia causes, and aphasia disorder is called as aphasia. Its ages are 4 to 8 years. Here, aphasia may be of some types like Broca's aphasia and Wernicke's aphasia, which is a learning disorder, language learning disorder. As we know, Broca's is meant for speech to produce speech, and Wernicke's is to understand the language and speech. So these can be the types on under aphasia. Assessment areas are expressive, comprehensive, oral motor, and phonologic memory, etc. Phonologic memory is ability to hear the words and understand accordingly. Phono is nothing but sound. Sound of the words should be audible clearly to the child. So this is a overall map of overview of assessment procedures for child language disorders. Thank you.